Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Tuesday, May 12th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Thank you, Brad, and good afternoon. Today I met with the Greater Toronto and Hamilton area mayors and chairs to discuss the need for the Province of Ontario to initiate joint action with the Government of Canada in support of municipalities in the wake of the devastating financial consequences of the COVID-19 crisis. This follows meetings that I have convened with multiple federal ministers and last night with all of the federal members of Parliament representing Toronto. Municipalities are on the front lines of fighting COVID-19 and, just as importantly, will lead in the restart and recovery of our economy, locally, provincially, and nationally. The GTA, the Greater Toronto-Hamilton area, helped to drive the economic prosperity that Ontario and Canada enjoyed before the pandemic, and a strong economic recovery in this region is crucial to both the province and to the country's success in the post-COVID world. That is why the mayors and chairs of the GTA municipalities gathered again to call for urgent action and to speak out with one unified voice. We appreciate the urgent and necessary action provincial and federal governments have taken to respond to the COVID-19 emergency, in particular through providing direct financial support to individuals and groups across the board, including renters, tenants, seniors, small and large businesses, and vulnerable populations. But it is absolutely critical now for the provincial and federal governments to take urgent action to address the dire financial problems being faced by GTHA municipalities, including Toronto, and for that matter, many other municipalities across Ontario and across Canada. We, municipalities, are spending millions of dollars to fight COVID-19, both to protect public health and to save lives. We are also losing hundreds of millions of dollars in revenue in total while trying to continue to deliver vital services like the TTC for our healthcare workers and a host of other essential workers, and to provide other essential services on an ongoing basis that our residents depend upon. Now is not the time to leave municipalities grappling with financial uncertainty. Given that our principal constitutional and practical relationship is with our provincial government, we are looking for Queen's Park to immediately initiate substantive discussions with us, with other Ontario municipalities, and very importantly, with the Government of Canada, with a goal of taking joint action to alleviate these financial difficulties. We need their joint financial support. By that I mean the Government of Canada and the Government of Ontario. We need their joint financial support, and we need it now. As we've been outlining over the last several weeks, municipalities have serious problems. They are problems affecting all GTHA municipalities, and we simply cannot afford to have constitutional or intergovernmental wrangling standing in the way of these frontline municipal governments getting the help that they need now, including the City of Toronto. While addressing these problems should involve a cooperative national effort involving national governments and provincial governments, it has to start, in our case, with a willingness to take action on the part of the Government of Ontario, since, as we are frequently reminded, we exist under provincial legislation. Under that very same legislation, municipalities, including Toronto, cannot budget for a deficit. We cannot generally raise money other than through property taxes, nor can we slash services that the provincial and federal governments rely on us to deliver efficiently and effectively and equitably, especially to our most vulnerable populations. Cutting services in the middle of a pandemic response or recovery, or dramatically raising taxes would hurt the very same people that the federal and provincial governments have tried to help with various of the programs that I made reference to earlier. I cannot stress enough that the very ability of the province and the country to enjoy as quick and complete a recovery as possible, which will be to the benefit of millions of Canadians, will largely depend on the ability of those very same cities, including Toronto, to deliver that recovery, as we must do and as we want to do. Approximately 20% of the entire country's GDP, the size of the entire country's economy, 20% of that comes from the Toronto region. And if GTHA municipalities are financially crippled, we will not be able to play our leadership role in bringing about that robust recovery. We all want to defeat COVID-19 and make sure we get back to our strong economy and vibrant jobs market as quickly as possible. A strong recovery will rely on strong GTA municipalities delivering transit, delivering infrastructure projects, delivering childcare, and continuing to deliver the public health response to COVID-19. We need all governments to be united in supporting municipalities as quickly as possible. Achieving this goal must begin with the Government of Ontario committing itself to providing assistance to the province's own municipalities and initiating discussions with the Government of Canada and with us. We will look forward to some positive response in this regard in the very near future, as in this instance, time is not on our side. We know that people are working hard to keep their distance in city parks. We know that physical distancing is and has been the key to helping us stop the spread of COVID-19 and to save lives. While all of our parks are open, parks' amenities have remained closed. One of our most popular parks' amenities are off-leash dog parks. And so it is not surprising that we are seeing an increase in dogs off-leash in our parks while the off-leash areas are closed. These areas were closed by the city when we moved to close all parks amenities and by the provincial emergency order which followed a few days later. I have asked Toronto Public Health and our park staff to get a plan ready to reopen our off-leash dog areas. Subject to the advice of our health professionals and with whatever provincial concurrence is needed, I believe this could happen sooner than later, and I want us to be ready to do that as quickly as possible. Much of this, of course, will rely on dog owners continuing to keep their distance from others in these areas. But I am confident that people will do the right thing and just want the off-leash areas open so they can exercise their dogs. The Canadian National Exhibition announced today that its board has made what I believe to be the right decision to cancel this year's CNE, and I want to thank them for making this responsible choice in the face of COVID-19. Public health must come first, and while we all have our fingers crossed for much better health conditions by late summer, prudence and the need for major commitments to be made by the X now if it was to open this year makes this, sadly, the right decision made at the right time. I believe we now have an opportunity for the CNE Association, the group that runs the X every year, city staff, Exhibition Place, and the provincial and federal governments to sit down and begin planning a modern CNE that would recommence in 2021, launching a new era in the history of one of Toronto's longest-running attractions and making sure that the X will continue to be a must-see and must-attend event for generations to come. I believe it is time for us to have a historic discussion about the 21st Century X. What is the 21st Century X? How can we better reflect the roots of the fair, if you go all the way back all those years, as a place to truly showcase the talents and creativity and innovation of our entire nation each and every year, and do it in a way that is family-friendly and fun. I would like to see us reimagine a CNE, which will keep its strong base of supporters here at home, but will also evolve to an attraction which will bring visitors from across North America and around the world. Today's sad news also gives us an unprecedented opportunity to re-examine and reimagine the CNE, and I am determined as mayor to see us embrace it. The CNE has been through a lot in its 142 years of history, and it has missed years before due to the Second World War. While it's another reminder that life isn't normal right now, I'm confident that we will get through this and will be the beneficiaries of this reimagining of the CNE. We will, especially with the support of the provincial and federal governments I've talked about today, come back stronger as a city. I'm confident of that. And we will have a determination as a city to build up those things that it was so sad for us to miss during the pandemic, and to make sure that we build a stronger and even more innovative and even more resilient and caring Toronto. And now it is my pleasure to call upon Dr. Eileen Davila for her report as Chief Medical Officer of Health for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 218 new COVID-19 infections in Toronto. To date, 5,449 have recovered, an increase of 109 since yesterday. More detailed data on the status of COVID-19 cases in our city is available on our website. I continue to receive many questions about the health risk of acquiring COVID-19 when an employee at a grocery store or other similar setting has the virus. Because there is community spread of COVID-19, not all infections amongst store employees were acquired in their workplace. The virus continues to spread in many different locations in our city, but the highest risk exists from close household contact with someone who is infected with COVID-19. This is why it is important for everyone to keep 6 feet away from others when they are outside and to wash your hands often. For local grocery stores, pharmacies, and other businesses, I continue to recommend the use of good infection prevention and control practices. This includes regular cleaning and disinfecting of frequently touched objects and surfaces. I think it's important to remind everyone that easing our public health measures will continue to be a gradual process until we have a vaccine or effective treatments for this virus. Until that time, physical distancing will be part of our everyday lives in all settings. I also continue to recommend for everyone to stay within your household bubble, as it's come to be known, in order to reduce the likelihood of disease spread throughout our community. This has been the advice for several weeks now and continues to be the best course of action in our city for now. While the overall rate of infection is going down in the province, which is good news, we need to be mindful that we still face the ongoing risk of COVID-19. So what does this all mean for our next normal? What might life look like until then? As we heard earlier this afternoon, the province will be announcing details of phase 1 of its reopening plan on Thursday. As the province relaxes public health measures, we can expect to slowly return to enjoying some of the activities that we have missed in recent months. However, we will need to continue to avoid crowds and, unfortunately, large gatherings for the foreseeable future. With the prospect of reopening, it becomes that much more important for everyone to continue to practice physical distancing. As I shared last week, in situations where you are in close contact with others and physical distancing is difficult to maintain, I recommend for people to wear a cloth mask or face covering to prevent the spread of your germs to others, even if you are not experiencing symptoms. This pandemic has brought us profound changes for which we have had no time to prepare. A recent survey suggests that nearly 2/3 of Ontarians indicate that leaving their home gives rise to anxiety. Further, the pandemic restricts our ability to reach out, to connect in person, to comfort our friends, families, and loved ones, and to help us cope and manage through these difficult times. Unfortunately, I do not have specific timelines on when our local situation will change, but I know that it will depend on our collective actions and our ability to maintain good physical distancing and public health practices like frequent hand washing. Based on your commitment, I am hopeful that we will continue to move in the right direction. I want to sincerely thank you once again for continuing to do your part. We are truly fortunate to live in a great city of caring, compassionate, and resilient people who are there for each other. Although we are physically apart, we are connected in spirit, and we will get through this pandemic together. In the meantime, I ask you to continue to rely on and support each other. So please, text, call, or connect virtually with your friends, your families, and your loved ones to check in on them. Please also continue to practice physical distancing when you go outside, and please continue to take care of each other. I'll now hand it to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. The response to COVID-19 in Toronto continues to be both a sprint and a marathon for our team. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. All aspects of EOC operations continue to operate 7 days per week, with over 60 days of continuous activation. We have continuously focused our efforts on creating innovative solutions throughout the pandemic. These solutions have enabled our team to respond immediately to issues as they arise and to effectively prepare for potential future challenges. For example, on May 10th, the Province of Ontario released a guidance document with respect to optimizing the supply of PPE during the COVID-19 pandemic. I am pleased to advise that our PPE task force, which forms an integral aspect of our EOC operation, has proactively developed and launched many of the measures that have now been recommended by the province. Our team developed and implemented several PPE conservation initiatives, which have assisted us in ensuring that a stable PPE inventory is maintained in Toronto despite the ongoing global supply challenges. Since early April, work has been ongoing to source and purchase reusable cloth isolation gowns, develop plans for the inspection, fit testing, and potential use of our pandemic stockpile of N95 respirators in the event that the current inventory can't be maintained, which has not become necessary thus far in Toronto. And we have developed a system to be able to collect, store, and decontaminate used N95 respirators, including acquiring the decontamination machines, the development of processes to facilitate the refrigerated storage of the used N95 respirators, and the development of internal processes whereby city divisions collect used N95 respirators for future potential decontamination. While the decontamination of N95 respirators has not yet been necessary, we are well prepared to proceed should that change. These developments are but a few examples of the innovative and proactive solutions that have been developed by our teams as we work to respond to the COVID-19 pandemic in our city. As you know, many of our retailers have started to reopen this week in accordance with recently amended provincial regulations and orders. I am pleased to report that we have not received any complaints as of end of day yesterday. Our business leaders are responding effectively to the changed landscape and are putting effective measures in place that enable them to deliver services while complying with provincial orders. We appreciate the efforts of every resident, business owner, and everyone in our city who is following these very important public health guidelines. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. This is where you can find the updated guidelines for retailers, among other important updates pertaining to our city response. Thank you.
Thank you, Chief. For reporters on the line, Mary Ann Bedard from Shelters is available, as is Paul Raftis from Senior Services and Long-Term Care. The first question is to Chanel Call from CP24. Go ahead, Chanel.
Hi, Mayor. Thanks for taking my question. I want to ask you about the CNE. This is an event that brings in millions of dollars, hires thousands of people. Can you talk about some of the discussions that you've been involved in that led to this decision?
Well, the discussions were really at their end because the board of the CNE is the organization that puts on the fair and would decide on the various business considerations. And I guess all I can say is that they had a number of very important business decisions they would have to make, contracts they'd have to let, people they'd have to commit to hiring around now for a fair that would take place in late August, as we know, where it was very uncertain as to whether a crowd scene of that kind was even going to be allowed under the rules or would be desirable from the standpoint of maintaining public health. And so the reason I said I felt they made the right decision is because I think we have to opt in all of these decisions in favor of public health, admittedly at a great cost to us in terms of enjoyment and jobs and all the things you mentioned. But I think it now gives us an opportunity to reimagine the CNE and come back in 2021 with something that can be, an event that is respected and admired around the world and that will attract more visitors than ever and be a great success.
Yeah, and on that note, I'd like to ask you about what that modern version of the CNE would look like. Do you have any details on how this could be a virtual event when so much of it is really dependent on being physically there?
Well, I think that, technology allows us to take the CNE around the world, for that matter, without people necessarily coming here. But I'd like to think they will come here because they will see a CNE, and this is just my opinion. Obviously, I've mentioned lots of people that will have to be involved in this reimagining since we now have the time and the opportunity. But I'd like to see something that goes back to the roots of the original CNE, which was a world exposition of Canadian talent in agriculture, in technology, in science, and that does it in a way that's fun. And I think we can do that. There's no reason we can't put on a globally admired and wonderful attraction of the caliber of our film festival at the CNE, and that will become known for, the latest things that Canada has done and that Canadians have produced instead of, and I don't dismiss this. I mean, it's great fun to have the double waffle, double patty, bacon jam, cognac, maple syrup, burger, but at the end of the day, we're much more than that, and I think we can demonstrate that we're much more than that to the world, and I think this is an opportunity for us to do that.
Okay, thank you. We'll go to Lucas Meyer now from News Talk 1010. Lucas?
Mayor, can you speak at all to the economic impact this will have, though, in the CNE not being here?
Well, it does represent an opportunity for thousands of young people to have some employment over the summer for a few weeks, and that often has meant a great deal to a lot of those kids in terms of the jobs. Obviously, all the different operators and people who display their wares and sell things at the CNE are going to be affected by this. But it is just one more tragic loss on the economic side that is as a result of this pandemic. But it is a result of the fact that we've placed, the CNE board and we all have placed health first, and said that those losses are tragic, they are traumatic, they have impact on individuals and businesses, but the impact is way worse of us having a second wave of this COVID-19, and we've got to take steps at reasonable points in time to stop that from happening.
And for Dr. Davila, as we start to see more restrictions ease and more businesses open, et cetera, can you think of a circumstance or scenarios where, beyond the recommendation of wearing a mask or a face covering, where do you see yourself, or would there be a circumstance where you would actually mandate it, either for businesses where customers inside have to wear those masks or face coverings? I'm just wondering if you see a scenario where you, as the Chief Medical Officer of Health, would say, this is not a recommendation anymore, this is, you have to do this.
So, Lucas, that's a very good question, and certainly an interesting issue that you raise. From what we can see in other jurisdictions, and I will say that we are looking towards the science, as we always do when it comes to making public health decisions, but given that we are talking about a novel virus about which we are still learning a great deal, we are also looking to the evidence of the instance, what is actually happening on the ground now in other jurisdictions, particularly those that are a little ahead of us in respect of their outbreaks. And to date, I have not seen that happen, so I don't anticipate it right now. But, I think that as with any good practicing public health professional, one has to observe the situations and be prepared to adapt and adjust one's recommendations in accordance with what we see on the ground. I think one always has to be prepared to change one's position depending on what one sees actually in real life and make adjustments as we see fit in order to best protect public health and to follow what seems to work in terms of best protecting public health.
Okay, thank you. We'll go to Taylor Simmons now from CBC News. Taylor?
Thank you. This is for Marianne Bedard or Dr. Davila and/or. Given yesterday's announcement of the first death connected to the shelter system, what else will the city be doing or should the city be doing to protect staff and residents there? We've heard some calls for mass testing, speeding up moves out of shelters, and also some frustration too that the 2-meter distance isn't being followed in some places as well.
Okay, we'll ask Marianne Bedard to address that. She's on the line. Go ahead, Marianne.
Thank you for the question. Yes, it was a very sad milestone that we passed yesterday. We have been implementing, a significant response for the last 2 months. It was sad to hear that we had our first death. And again, I'd like to offer my condolences to everyone who cared for this man and for his family. And it just identifies much more, the need for us to continue implementing our response and for it to continue changing and responding as the pandemic progresses. We have moved 2,425 people out of the shelter system and into alternative accommodations using a variety of hotels, community space, interim housing, and permanent housing. Almost all of the shelter system now has been able to achieve physical distancing, and we're just in the process of sending out our quality assurance teams to verify that has in fact been achieved. And I think within the next few days we'll be in a position to feel confident about that. It sort of re-emphasizes the need. Last week we identified the use of masks across the system for all staff, which is over and above public health guidelines, but does just reiterate the importance of both protecting our staff, but also of protecting our clients. So we will continue to take those measures and respond as we need to, and continue offering shelter to the most vulnerable in the city.
Okay, and in terms of testing, where are we at shelters as well?
Well, I'll probably ask Dr. Davila to respond to the testing question.
So happy to take that question, Marianne. So we are working in partnership with shelter providers and with the local health officials that are able to provide the testing. Because as you'll recall, that while public health supports and helps to facilitate testing, in fact, the testing is done by healthcare providers. So it takes a collaborative effort amongst a series of providers, some from healthcare, some from the shelter setting, and some from public health in order to coordinate that. So that is an endeavor that is actively underway. They have put together a list of working through priorities, trying to focus first on those where there is clearly evidence of some kind of disease that's happening, and then moving through the rest of the system, right? We want to focus the resources where they're needed the most, but then make sure that we are going through the rest of the system in order to provide that service. And again, that's being done in collaboration with all those who need to be engaged so that that can be done effectively and efficiently.
All right, thank you. We'll go to Ben Spur now from the Toronto Star. Go ahead, Ben.
Hi there, thanks. This is a question for the Mayor. Mr. Mayor, the TTC published a report today that said the agency is facing a $500 million shortfall by Labor Day and won't be able to continue providing necessary transit service without a bailout from the provincial and federal governments. In separate statements today, the federal government said transit operation is a provincial responsibility, and the provincial government said this is a national problem that needs federal action. With neither of them taking responsibility for this issue, are the other orders of government telling you the TTC is on its own and shouldn't expect a bailout?
No, I think what is going on here is one of those things that I made reference to, a kind of a, to use an old-fashioned phrase, after you Alphonse, sort of routine where nobody's stepping up first. But I today indicated very clearly, and joined by all of the mayors from the GTA, that it is our expectation, since cities are the responsibility under the Constitution of the province, that the province will step forward first and indicate not only its willingness to help financially the plight of the cities, but also initiate discussions with the federal government and us to alleviate some of these problems, many of which have to do with transit. I can tell you this much. One of the mayors in the meeting today raised the fact that Windsor, Ontario, a city of some substantial size, not as big as Toronto, closed its transit system. That is not only unacceptable, they should have to do so, but I can assure you that is not something that we could even for 1 second contemplate, nor would I contemplate that. And the notion that in the economic engine of this province and of this country, that we would be left to try and absorb in some fashion or other $500 million attributable to a pandemic that is nobody's fault, without the support of those other governments, is inconceivable. And so I'm an optimist. I believe that while there is this sort of routine going on at the moment, that we have, I think, put the initial responsibility where it rests, which is for the province to commit to helping its municipalities with transit and other matters, to then help by bringing the national government to the table, which I think they will do. I've been spending a lot of time talking to officials of both governments, and I think that we can fashion some kind of a solution to these problems. But the notion of letting the TTC kind of become a shadow of itself or not offer reasonable service to people, or in the case of Windsor, close down, not an option. It's been declared years ago an essential service for a reason, because it is, and because it'll have a lot to do with the economic recovery of this entire country, leave alone the City of Toronto.
And if I could just follow up on that, could you talk a little bit about, I mean, can the city get back on its feet without a well-funded, robust transit system? I know the city's facing a lot of financial pressures, but can you, specifically transit, is that an item that really needs to be well-funded?
If you look at our shortfall that we've said we need help with from the other governments, it's $1.5 billion at the bottom end. And when you see in the report that $500 million of that just to Labor Day is transit alone, you begin to understand how much an important part of transit is, not just to our financial situation, but to the well-being of the city, its people, social equity issues. There's a whole host of things that make the transit crucial to the success of this city. And the success of this city, as much as people don't like to hear it in the rest of Ontario, anywhere north of Steeles Avenue and anywhere else in the country, the success of this city will help to determine the success of Canada and Ontario in getting out of this mess that we've been in through nobody's fault. And so I just know that the common sense of that will mean that the other governments will come to the table. It's taken a bit longer than it might, but they had some other things they were dealing with, and I'm prepared to thank them for that and extend the benefit of the doubt. Now it's time to talk about cities and their well-being across this province and across this country, and we're calling on the Queen's Park government to step up and initiate those discussions for us here in Ontario. All the GTA mayors agree unanimously on that, and we look forward to those discussions.
Okay, thank you. We go to Mark McAllister now from City News. Mark?
Mayor Tory, if you would, the 60-day grace period for property tax utility bill payments actually ends this Friday. While the city revised the due dates last week, the circumstances for many haven't really changed. Can the city not extend the grace period longer?
We discussed extending the grace period, but I will just tell you in the spirit of honesty that it will simply magnify what are already grave financial problems. And so the answer at the present time is no. People don't have to make another payment until June the 1st, and I realize for some that will be very close, and they will still feel themselves to be in a financial pinch. But I will just say that we have studied the option of trying to defer this for an additional period of time, and we simply cannot afford it when we're at a situation where we're already facing, for example, without help from the other governments, a 30% increase in taxes. That's why even contemplating that is not on the table, because some people can't even pay their taxes now, let alone 30% higher taxes, nor is the option available to us to dramatically cut services like transit, like childcare, like our parks and recreation, which are already suffering from the pandemic. So the answer is, for the moment, has to be no, because we just can't afford it. I'm just being straightforward and honest. I wish I could say yes to that, but I can't.
That's all. Thank you.
Okay, thank you, Mark. We'll go to Francine Copen now from the Toronto Star. Francine?
Oh, hi. My question is from Mayor Tory. Going back to reimagining the CNE, do you have any other fairs or festivals in mind when you talk about reimagining the CNE? Like, what is it that needs that you see as the future?
I would like to see an amalgam of the best of the best. That's what Toronto should represent, given especially that we're the world's most diverse city. And, you know, things that showcase the best of music, the best of the arts, the best of technology, the best of agriculture, because that's a continuing and increasingly important part of feeding us and keeping us, you know, as good stewards of the environment. And so I don't want to take away the fun of the crazy food or the crazy rides. We can still have some of that, but I just think there's much more that we can present to ourselves and present to the world. And I think now it's not going to be up to me and what I think it should be. It's going to be up to a group, I hope, of distinguished people drawn from all the organizations I mentioned to have a look at what's going on around the world and just make sure we can say to ourselves, our Canadian National Exhibition is one of the best attractions in the world that really shows us for who we are and what we've done. And I just think that's the minimum we should expect of ourselves, and we've got an opportunity now to do that.
Thank you.
Okay, thanks, Francine. Final question to Matt Bingley from Global News. Matt?
Hi there, Mayor. I'm just wondering, we've been seeing a lot of, well, all levels of government, including the municipal one here, sort of issue these announcements daily. And I'm wondering, with your call for funding for the city, are you getting an indication that maybe there will be some sort of municipal funding announcement coming from either the federal or the provincial government in the coming weeks? And does this approach of sort of putting these announcements out in drips and drabs, is that a good method for you?
Well, things have to happen in some order, and I certainly understood and endorsed and commend the Government of Canada and the Government of Ontario for announcements they made that helped individuals that were struggling, that helped small businesses that were struggling. These were important things to do. The provincial government made a big commitment to the healthcare system and making sure it had the resources it needed. So I got that. But I now think it is time, you know, when you're talking about, for example, giving assistance to big corporations, and again, I understand they employ a lot of people and they're very important to the well-being of our economy. So are cities. Cities are at the heart of Toronto itself is the economic engine of the country. Cities across the country are at the heart of a strong and recovering economy, and so it's time now. It's time to have that discussion, and I've you know, along with the other mayors, I think we've been very patient in understanding there were people who perhaps came ahead of us in terms of an urgent need, but we have an urgent need now, and our urgent need is going to pay itself back many times over if it's fulfilled by these other governments, because we will help the country to recover, and we will produce, in so doing, the revenues they need to fund these programs, income taxes, corporate taxes, sales taxes. We don't get any of that, but we get the health of our communities, the health of our cities in which 80% of Canadians live. So it's time for the Ontario government to step up and say, we're going to lead those discussions as it affects Ontario cities. We're going to bring the federal government to the table, and I'm optimistic that they will both come if they both just put their minds to it and say they're going to do it based on all the discussions I've had.
Thank you.
Follow-up? Yeah, go ahead, Chris.
Mayor, what's the ask? Talking to the GTHA mayors, I guess, I'm not sure how many mayors, but knowing Toronto's numbers, there must be an ask when you talk to the upper levels of government. Are we talking $10 billion, $20 billion? What's the framework for that ask?
The national organization, the Federation of Canadian Municipalities, indicated that the sort of cumulative total of support needed for Canadian cities was between $10 and $15 billion. We've pulled together, as a result of these meetings that I convened, the amount that cities in the GTA, the 10 biggest cities, are bleeding, which amounts to about $100 million a week. 65 of that is ours because we're by far the biggest city, but then the remaining 35 million is all the other cities per week. And so if you do the math, assuming again a 3-month shutdown and a 6-month recovery period, you'd come out with a number that is, you know, in the hundreds of millions of dollars. But that is spread across the 10 biggest cities that account for about probably 6 million people in this province. So this is a big number of people that are represented by those governments, and those cities are the key to the future economic recovery of this entire province and this country. So it seems like a big number. It is a big number. But if you even compare it to what's been invested in other areas, quite properly so, it is something that I think is going to pay big dividends for Canada, for Ontario, and for these cities and their people.
Okay, thank you very much, everybody. That concludes today's briefing. We will talk to you again tomorrow at 3:45.